Once again, welcome back to my channel Science Circle. Today we will be discussing a bit different type yet the most popular topic, that is on coronavirus. Coronavirus is an infectious disease. It has not only affected the people of India, but it is now a major problem all over the world. Many people die due to coronavirus. COVID-19 disease is caused by SARS-CoV-2, which belongs to the family of coronavirus, named for its crown-like spikes on its surface. SARS-CoV-1 occurred in 2003. It originated in China. People of China, Vietnam was affected by it. Not only that, people of America was partly affected by SARS-CoV-1. COVID-19 is actually a viral infection that attacks the throats and lungs. We will discuss what happens to our body when we come in contact with SARS-CoV-2. As we know, virus can infect only living cells to reproduce itself or to increase in number. COVID is having two layers, the outer layer and the inner layer. The inner layer is made up of protein. Inside the virus, the genetic material RNA contains the information to make its copy. This RNA is surrounded by this protein shell, that is the inner shell. The outer envelope that is present allows the virus to infect other living cells. It merges with any other cell's outer membrane by its spike protein. The spike protein is projected from its envelope. These spike proteins are the key to enter the cell of our body. How does it spread? When any infected person talk, cough or sneeze, the droplet which is carrying the virus land on your mouth or nose, and then it moves to your lungs. And once it moves to your lungs, you are affected by COVID-19. Now, how is this mechanism occurring? Just have a look. Once the virus is inserted with its spike protein onto the receptor molecule of our cell's cell membrane, it allows the COVID virus to enter into the cell. Inside the cells, the COVID-19 virus produces viral protein inside the host cell's ribosomes. All these viral proteins help to form new viruses. As the new viruses are formed, they are released from the host cell membrane and it starts spreading. In this way, the number of the viruses are increased enormously in a large manner. What are the symptoms of COVID-19? Based on the current data, over 80% of the patients with COVID-19 have a mild infection and some do not develop any symptoms at all. For less than 20%, they are developing the symptoms that can range from sore throat, headache, fever, dry cough, shortness of breath and fatigue, and ultimately leading to the serious problem like pneumonia. Severe lung damage from pneumonia can cause acute respiratory distress syndrome or ARDS. The severe infection can cause septic shock. In septic shock, the blood pressure falls very low and the body organs are suffering from the low level of oxygen. These ARDS and shock are the main cause for the death from COVID-19. And the people who are mostly affected by this disease is the age above 60 years. Smokers and the other people who are having the medical conditions for like heart and lung disease are also affected by COVID-19 very easily. To confirm the diagnosis, RT-PCR test is done. This can detect a very small amount of viral RNA. Now let us discuss about the treatment of COVID-19. Treatment is focused on supportive care, such as IV fluids, oxygen, ventilatory support is required for critical patients. Few drugs like remdesivir are currently on trial for the treatment against COVID-19. Unfortunately, there is no vaccine available till date to protect against COVID-19. So what is the main goal now? The main goal is now to avoid the person-to-person transmission. This is the only way we can protect our community. The areas with community transmission should follow the following rules. Anyone with mild symptoms should wear a mask and remain self-quarantined in home. If the symptoms are seen and they are becoming day by day severe, they should go to the doctor's chamber or nearby hospital. During self-quarantine, one must use separate room and a separate bathroom and avoid sharing the household items like bed or eating utensils. Anyone with symptoms must not attend school, work or any social gathering. In fact, they shouldn't travel also. People who do not have any symptoms but are at higher risk, like people aged more than 60 years and people with chronic diseases, should also remain self-quarantined and remain safe. Healthy person in a non-outbreak area should avoid traveling to the disease outbreak areas. Stay away from crowd. Stay at least 6 feet distance from anyone with symptoms. Clean and sterilize the surfaces like door handles, keyboards or any metallic surfaces. Be careful about hand washing, which should be done with at least 20 seconds, either with a soap or with any alcohol-based sanitizer. So from this video, hope all will take the necessary steps to ensure that you are all prepared well to face the challenge and threat posed by the growing pandemic of COVID-19. By following the precautions as per the advisories being issued, we can prevent the spread of this virus. So stay safe and healthy. Hope you all will like my video. Please share your comments and don't forget to subscribe my channel for getting more interesting videos. Thank you.